Hello, my name is Kate Rademacher. I'm a Senior Technical Advisor and Project Director at FHI 360, and I'm delighted to be speaking with you about my project for WomenLift Health, Reclaiming Rest, a Global Health Imperative. In 2019, the World Health Organization recognized burnout as an occupational phenomenon for the first time. This really reflects emerging evidence documenting the prevalence of burnout among frontline healthcare workers. This includes healthcare workers both in developed countries and in low and middle income countries. And of course, the burden on healthcare workers globally has only increased during the COVID-19 pandemic. I also see this playing out among my own colleagues who seem to often struggle with chronic overwhelm and stress and bordering on burnout. These are just a few of the quotations people have said to me over the years. I think working on that last grant proposal nearly broke me. I feel guilty taking a vacation. Most of the time you can't totally switch off. I just don't think I can keep doing this for another 20 or 30 years. And perhaps most poignantly for me, maybe our daughter's generation will figure out how to balance it all. We certainly haven't. This, of course, is happening. Many of us have been working over the past 2 decades as the pace of communication has accelerated dramatically, while just at the same time, the boundaries between work and personal life have eroded. I think the Wall Street Journal headline here captures it well. Sunday night is the new Monday morning and workers are miserable. And of course, for those of us who are working in global public health, this may be compounded by the fact that our work is so important and we really feel that strongly. You can see the Sustainable Development Goal here, 3 incredibly ambitious targets. And in the lower corner, Bridget Schultz's quotation, New York Times bestselling author of Overwhelmed, mission-driven nonprofits face a particular challenge. Workers there often think that their work is so important that it matters more than work-life balance. This is also a deeply personal issue for me. I just finished researching and writing a book, Reclaiming Rest, which was published in June 2021 by Broadleaf Books. And you can see there on the side my daughter, Lila, who's 15 years old. And this picture is her when she was helping me with the bibliography for the book. And you can see from her facial expression, I think she's perhaps a bit skeptical that her mom needed to research and write an entire book about rest, or perhaps get a bit better about resting in my own life. But truly that she represents for me the next generation. And I think so many of us struggle with this concept of work-life balance. What does that even mean? Is it achievable? And we're not just figuring this out for ourselves, but we're also figuring it out for the next generation. So as part of my project through WomenLift, I really thought more deeply about this issue through a public health lens. And again, I worked on a theory of change, which I refined throughout the year, looking at really components that have on the individual level, the organizational level, and the policy level in terms of where we can find levers for change. I want to share 3 top line takeaways from my project. My project included a deeper dive literature review and informal interviews with colleagues from all levels, early career, kind of mid-career, and also later career, including at the executive level. And perhaps this is not surprising, but my number 1 takeaway is that this is a global health issue. Burnout, stress, overwhelm. I was really just struck by how in my conversations with colleagues in the US, but also internationally, I talked with several colleagues who I work with closely based in sub-Saharan Africa from multiple countries. And again, at all levels, junior, mid-career, and later career. And just this is a ubiquitous problem. People feel just incredibly sort of overwhelmed and they don't know what to do about it. And, of course, we know from the evidence is unequivocal that we need rest to be healthy. But also this is a human resources issue. If our best people are exhausted, overwhelmed, stressed out, maxed out, it's going to affect the work. And as I just said, our work is so important. So we really need to tackle this issue on multiple levels. Rest is also clearly a justice issue. On a very obvious level, it's an economic justice issue, who can afford to rest, but also more deeply the question of who has the right to rest. I was writing my book during the pandemic, but also as we were confronting in the US the ongoing effects of violent white supremacy. Breonna Taylor was killed literally while she was sleeping, and Ahmaud Arbery was jogging for leisure when he was chased down by 2 white men and murdered. So this is really fundamentally a justice issue on so many levels in so many ways. There's also valuable feminist critiques that are going on around overwork and overwhelm. I realized in this journey when my own sort of brand or flavor of feminism is really tied up with workaholism. And I love some of the reading and conversations I've been able to have. I gave a talk with the young employees professionals at FHI 360, and just clearly how these issues are being thought about. You can see the quotation here from Girl Boss. The women's liberation movement of 40 odd years ago had more ambitious goals than simply luring women into workaholism. And on the side, feminist dystopia comes in the form of medicated hyperproductivity. Also, rest is a part of sustainability, and our vision for sustainable development has to include a vision for what healthy work rest balance includes. My WomenLift coach, Monica Rivers, said something that was so compelling to me. Instead of work-life balance paradigm, I encourage asking the question, how do we cultivate sustainability? And that makes me think about, again, sustainability as we define it as part of the SDGs. You can see here SDG 12.2, I'm talking about natural resources. But of course, we and our colleagues, our families, our friends, we are incredibly important, valuable natural resources. And so we need to make sure that we're managing those sustainably, ourselves sustainably as well. So immediate next steps, I'm delighted to be working on a manuscript with colleagues in Nigeria and in the US. We have an outline developed where we're going to be really looking at this issue through both a public health lens and a decolonization lens. I'm part of the decolonization steering committee at FHI 360 and was able to make a presentation to that group as part of my WomenLift project. And I'm going to be expanding on some of those, that thinking that's ongoing. Working on a new website where hopefully can be a place where we also continue the conversation, reclaiming-rest.com. And of course, I'm making time for rest. I have a really diligent weekly Sabbath practice, and I'm about to take some leave. So as I conclude, I just want to wish you all the best in your own work and in your own rest, and to thank you all so much, and especially the team at WomenLift for being a part of this incredible journey, and to my cohort who've just provided so much support and inspiration along the way. Thank you.